Hello there. My name is Tom Contio. I'm one of the pharmacists within the Thames Valley Family Health Team. You're joining a session that's been archived. This particular group, the Leave the Pack Behind, is a virtual group that meets monthly to help individuals who are looking to quit smoking be successful. And this group has a lot of different things that are valuable to kind of experience in a group format, maybe talking to others who may be in the same boat as you, maybe share some secrets. But this archive session is to allow you to be able to get the basics of the group um, and then just to help you on your journey on your own schedule. So just a basic outline of what the archive session today will entail. We're going to start off with a video by Dr. Mike Evans talking about addictions related to smoking. We're going to go over some of the basics on really what your journey may look like as you try to quit smoking, some of the medications that may help, and then some next steps for you as well. So I'm just going to share this video with you. Give me a moment. Here it is.
Hi, I'm Dr. Mike Evans, and I think quitting smoking is a journey. For some, it's a short journey full of resilience, but I think for most, it's a long journey, a long affair, if you will, of quitting and relapse. A complicated relationship that can have as much to do with a person's relationship with themselves as with the cigarettes. What starts as a pleasant sensation, an opportunity to rebel, or even to belong, is replaced by less pleasure and a feeling of being trapped. A daily or hourly ride of nicotine withdrawal, and then another cigarette, which brings relief. Most teens who smoke think they will quit in their 20s and actually don't till their 40s. Stopping smoking is about making a change, and that is something we're not too good at. When I think of change, I think of two concepts, where you are at and the mechanics of how we change. So we should start where you are at. When I started medical school, I thought I could take somebody who smoked and convert them into a non-smoker in one fell swoop. Now I see it differently. I focus on where the person is at. You may be in what we call pre-contemplation, where you're not really even thinking about change. Approximately 75% of smokers want to quit, but 25% are not interested. Maybe you're at the contemplation stage, thinking about it, but not quite ready to act. Next is preparation. This is critical with smoking, especially in the likely event that you've tried to quit before. What has worked in the past and what hasn't? What caused the relapse? Maybe you're at the action stage. This is when you're ready to make your move. There's never a perfect time to quit, and at one point you just have to jump. I'll tell my patients, hey, it's going to be a challenge now, and it's going to be a challenge in 5 years, so why not do it now? And finally, there's the maintenance stage, where you become a non-smoker and are trying to stay that way. When we make changes, it's critical to stop and think, how important is this change to me, and how confident am I in making this change? What we call your self-efficacy. Your job is to be honest. My job is to see if I can move your scores towards 10. The second concept is about the different parts of change. So there's the what. What are we changing? With smoking, I suppose it is straightforward, stopping. But if you think about it, you might be changing lots of things. I think it is like a relationship breakup. You start by just keeping things simple and low risk. Avoid certain places. Maybe use that juicer every morning to distract yourself. But you will need to change more than your smoking to stop your smoking. The next is the why. Why change? I feel like I could do a 10-minute video just on all the medical reasons why not to smoke, and they are legion, but I'm going to spare you. Partly because you already know, partly because you don't need any more guilt, and partly because in clinic I actually spend more time asking people what they like about smoking. Which sounds funny, but I think we have to recognize there are positives, or at least perceived positives, and I think it's important to reframe these perceptions if we are to make a change. So let's run through a few of the common ones. Cigarettes are my friend. They de-stress me. They relax me. I'm not going to deny that you may feel a sense of relief and satisfaction when you have a cigarette, but I see it a bit differently. You have a nicotine addiction. The nicotine in tobacco is highly addictive. Within a few seconds of inhaling, it travels to your brain, causing you to have a temporary high. Over time, your brain changes, causing you to smoke more to get the same effect. We rate your addiction to nicotine with a few simple questions. Do you smoke more than 15 cigarettes a day, or smoke within 30 minutes of getting up in the morning? Do you find it difficult to go more than 4 hours without a smoke? The power of nicotine comes from the repeated small doses you give yourself when you smoke. It may seem innocent at first, but if you take 15 puffs from a cigarette and smoke, say, 20 cigarettes a day, that's 300 drug doses a day. You think smoking relieves your stress or is satisfying, but it actually isn't. The cigarette is just making your nicotine addiction go away. Smoking doesn't make your concentration better. It just calms your nicotine receptors' cry for more. Smoking makes your heart beat faster, increases blood pressure and breathing. These are all symptoms of stress, not stress reduction. Let me repeat that. The cigarette just reduces your nicotine stress, not your real stress. I've got a lot of trigger times: coffee, sex, meals, certain people, break times, telephone calls, the car. There are a lot of triggers you're going to have to prepare for. You got to change your coffee routine, plan something to do right after meals, throw out your car ashtray. I have no advice on sex, but make a plan for breaks or the telephone with lots of distractions. Know that when you have a hunger or caffeine or other types of pangs, you also have a nicotine pang that needs to be satisfied. You have associated these, but they're actually separate. Alcohol and parties double the risk as you have the association, plus you're imbibing something that tends to lower your resolve. I want something in my hand. Yes, you are making maybe 300 hand motions a day. You may need to replace this by chewing gum or chewing on a straw or a cinnamon stick or playing on your cell phone to keep your hands busy to replace this daily habit. I will gain weight. Yes, you might, but I think this is actually more marketing than reality, what I call the Virginia Slims effect. On average, people who quit gain about 2.5 kilograms or 5 pounds. So, two thoughts on this. Firstly, if this is a concern for you, you might want to focus on strategies that affect calories in and calories out, such as your new daily routines might focus on walking, a special emphasis on being mindful of emotional eating, or that your hand-mouth routine includes carrots or celery sticks. My second point is about perspective. A possible 5 pounds may be important from a vanity perspective, but from my doctor perspective, the health return is spectacularly higher when you stop smoking. Remember, we said smoking was a relationship. Part of the healing of stopping a damaging relationship is starting new healthy relationships. So now is the time to start a deeper relationship with your bicycle or salads or walking or gardening or your supportive friends. Next is the how. What are the skills required to change? How do I change with the emphasis on I? So what works? Well, let's start with willpower. It's a strange word. On the one hand, it permeates behavior change and all the interventions we talk about. It's also a word I don't love as people see it as black and white. If a person succeeds, they have willpower, and if they fail, they have no willpower. The science of willpower in smoking gives a mixed message. Approximately 5% of smokers who try to quit cold turkey achieve prolonged abstinence for 6 to 12 months, with most relapsing in the first 8 days of attempting to quit. On the other hand, most people who quit do so unassisted. Maybe 2/3 to 3/4 of people do so by themselves. Reconciling these two stats reveal the natural history of smoking cessation, that, quote, failures are part of this process and can be seen as dress rehearsals for the eventual success. Another key pearl here is the data which tells us that our perception of the quitting smoking experience is often much darker than reality. In a British study of people who were surveyed about their quit experience, 53% said that it was not at all difficult to stop. 27% said it was fairly difficult, and the remainder found it very difficult. So to summarize, you can do it by yourself, and it may be less difficult than you think. On the other hand, it looks like your chances are better if you layer on some other tactics. So if you fail, try again and think about adding another strategy. Some say there are two types of cigarettes, those that are dealing with your nicotine addiction and those that have become part of a routine. So let's see what works for both these types of cigarettes. Let's start with treatments that have not been proven effective and where you may be wasting your money. Now, some of my patients have found they help, and to be honest, if they stop your smoking, I suppose I don't really care. But under this category, I put laser therapy, acupuncture, and hypnosis. When we compare these treatments to a placebo or just compare them to the quit rates of people on waiting lists, the rates don't appear to be improved. Next is medications to help stop smoking. The data shows that medications, especially when combined with behavioral support, can double your chance of success. Many patients are resistant, which I get, but I also see an irony in the fact that people are willing to inhale chemicals much, much worse for them, but they won't take a medication for a few weeks or months to stop smoking for the rest of their life. If we use nicotine replacement therapy as an example, it allows people to deal with the addiction of nicotine without having to inhale the other 7,537 chemicals in cigarettes. And that's what I worry about. People die. 2 full 747s of people a week in Canada from smoking, not nicotine. Nicotine replacement therapy comes in multiple forms, and there is usually less nicotine than what you get in a cigarette. You can put on a patch, which is easy and discreet. You can chew gum, although in a different way than you usually chew gum. You can suck on a lozenge, or you can use an inhaler. The patch gives you a nice baseline nicotine level to lower your cravings. The latter three offer the advantage of flexible dosing when you have a nicotine craving, and a familiar routine of opening packages and putting something in your mouth. Important things people need to know about nicotine replacement therapy are, firstly, you can design your own nicotine program. You do not need a prescription. Prefer the patch and then the gum or lozenge or inhaler for breakthrough cravings? Great. Maybe you smoke under 10 cigarettes a day and just want to use the gum when you need it. Your pharmacist can really help here. People get a bit confused with the cost. NRT is generally cheaper than smoking, but you might be buying a month at once. Money-wise, of course, it's a no-brainer. A pack a day is maybe $3,600 a year. Imagine what you would do with that money. Imagine what you would do with 10 years of that savings. Secondly, with nicotine replacement, you can stop cold turkey, or you can wean down your smoking. Taking nicotine and smoking together does not increase your risk of heart attacks. Smoking does. You probably started smoking gradually, and I guess the same can be true of stopping. If you feel you need another month of NRT, then that's fine. I'm not going to go into details of pills for smoking cessation, but I will give you a quick overview of the two most known ones. The first is Zyban or bupropion. It started just as an antidepressant, and then users found their desire for smoking dropped and they were able to quit more easily. Champix or Chantix in the US is varenicline, and it is a newer option that may be even more effective, but also has some side effects that may make it not for everyone. You can discuss these options with your doctor or other healthcare provider, as the counseling needs to be individualized. The final approach is the behavioral interventions. I covered some of this ground, but I don't think people realize how many fantastic resources are out there for them. Governments make a lot of money from people who smoke, and they funnel into superb programs. You want a text message, a supportive email, you want expert counseling, want to be connected with other people going through the same thing, or who have just been there. Or maybe you just want to talk to someone. Go online, call the helpline, buy the book, get the message. In the first months following quitting, I want you to prepare for the roadblocks of risk and stress. So avoid high-risk situations. You know what they are. You might want to tell the people involved in advance. And I want you to focus on stress reduction. Stressful things are going to happen to you, but you create the stress. Tell people, hey, I'm quitting smoking this month, so what's the least stressful strategy that works? I also get people to think about the 3 A's. Avoid situations you know are stressful for you. Alter expectations. So when you look at your to-do list, be realistic. Manage expectations up front before it's stressful. And the final A is acceptance. If we use driving as an example, traffic jams, bad drivers, and flat tires happen. Take a deep breath, focus on what you can control, and accept what you can't. Now, let's say you quit smoking. That's excellent. You've broken up. So what now? Well, first of all, you're great. Secondly, there's going to be some ups and downs, more ups, especially after you get through the first months. But some of the things to expect with nicotine withdrawal are cravings, and these don't follow a perfect line. Headaches, nervousness, irritability, trouble sleeping, and you may want to eat more, so have some healthy foods ready. And also people tend to have more of a cough as their lungs self-clean. Finally, the Japanese have a proverb that success is falling down 7 times and getting up 8 times. If you get derailed, don't feel guilty. As I said at the beginning, this is a journey. Come back and see us. This is the best thing I can do for you. Don't learn helplessness. Learn about yourself and get ready for the next round. And thanks for listening.
Great. Great little video, and you can always find that one back here again if you want to look at it one more time. But we're going to be covering a lot of that information right now as well. So just going to get back on our presentation. All right. So I'm going to invite you to have a piece of paper and maybe a pencil and just something to kind of jot things down here. And I want you to maybe pause the video for about a minute or so. Sorry about that. Video still playing in the background. Great. So I'm going to ask you to just stop the video just for a brief amount of time, just to really copy down 3 things about why you want to quit. And I want you to really watch for what that is. You know, I want you to really pay attention to, are they health related, or maybe they're important about being around for other family members. So just stop the video now and you can just jot those things down before we continue. All right. So as mentioned, a lot of the individuals that I work with, many of them do list that medical concerns or health risks are really something that they're concerned about at the time they're looking to quit. Maybe they've gotten a negative diagnosis of something. Sometimes people are, wanting to quit mainly for a control issue, and we see that quite often, and that's an important one. Sometimes for cost, but I think the biggest one is to be there for family members. Maybe they want to walk their son or daughter down the aisle, or maybe they want to be around for their grandkids. So it's important to keep these ideas front and center for yourself, because when it gets tough, you want to remind yourself of why you're doing this. I often suggest to put a little note up on the mirror so they can see it every day. Why am I quitting? The next thing I want you to kind of look at is, what do you like about smoking? And this may be surprising for many people that I'm asking you this, but I'd like you to stop the video for a second and jot down maybe 3 or 4 things that you like about smoking. Do that now. Okay. So on your list, you might actually like how it helps you transition between different activities, how you find that it relaxes you. And they talked about that relaxing or that sensation of it relaxing you in the video. Some people also like it because it helps them kind of fit in as well with maybe others at work or around their friend group. It is a very social thing in the sense that it gives you something to do when maybe there's again those awkward silences. So those are some of the reasons why many people do like smoking, and you'll have your own as well. Next one, I'm going to ask you, what do you hate about smoking? And I'm going to ask you to turn this video off now and jot down maybe 3 or 4 things you hate about smoking. Do that now. Okay. So other people in previous groups have mentioned, they don't like the smell. They don't like the cost, how much it's costing them. They don't like the fact that maybe they started out thinking they were in control, but now they realize that maybe they're not. So that's an important one as well. And again, it's important to realize what those reasons are for you, and really just focus on those as as you kind of go along. Maybe you need a day to kind of help motivate you some more. So often we'll get questions from individuals. What are the benefits of quitting smoking? Within minutes of quitting, you'll notice that there's a positive effect on your blood pressure. You also will notice that you have more oxygen available. As the weeks and months go on, you'll notice that there's going to be a lot more breathing easy. And the video mentioned, again, you have a lot of, house cleaning the body does when you quit smoking. And that's really those lungs kind of clearing out as well. Sometimes things like your taste and your smell will kind of come back, and a lot of people are surprised by that because they didn't realize they were missing them. Later on, when we start talking later on in months or years, we do know that your decreased risk for things like stroke and decreased risk for death from smoking or lung cancer, those risks go down significantly as the years go on as well. So definitely some very good benefits. And again, just in a general sense, people always wonder about cancer. The actual smoking does increase the risk of all cancers. And again, this cancer risk for many people will go down after about 5 to 10 years. You'll be back to the same risk level of an individual who may not have smoked. So that's an important one when we're thinking about long-term success. So there's really 2 sides to nicotine addiction. And there's really going to be the physical part of nicotine addiction. And sometimes I give individuals the analogy of a little devil on your shoulder and he's kind of yelling at you. So this is that physical part. This is that high that you get from the nicotine itself, which is a stimulant. And again, when that dependence is there, what happens when the nicotine level goes down is you're going to get withdrawal. And that withdrawal will happen sometimes within about 4 to 6 hours, but on average, it's about 24 to 72 hours for its worst. And it does actually subside after a couple of weeks. A lot of people are afraid that it's going to go on forever, but if you decide to just cut off nicotine, that's how long that withdrawal period would probably last for you. From a habit standpoint, this is what I always say. People are addicted to nicotine, but they're also addicted to the hand-mouth behavior. As a pack-a-day smoker, you'll do this 160,000 times a year. So that's important to realize. And again, why that's important? Because you're linking the habit of smoking with everything in your day. And this is going to be things like work, friends, meals, coffee, social drinking, talking on the phone. Those are the really hard part to get rid of, because what's happening is you're linking it so closely with these daily activities, then you have to find ways of replacing them as time goes on. And it's a little quitting strategy. My doctor says I needed to quit cold turkey, and it's good because I wasn't doing cold turkey in the first place. So let's start talking about the products that may help you in your quit attempt. As the video had suggested, we really have very poor evidence to support the use of any of these following things: laser therapy, hypnosis, acupuncture, and aversion therapy. These are therapies that individuals will hear about, and everybody has a friend who was successful. And as the video had suggested as well, Dr. Mike Evans says if it does work for you, it really doesn't matter whether it has low efficacy or not in the trials. Guess what? If it helps you quit smoking, all the better. But some of the more known modalities and ones that have a little bit more evidence, let's talk about those now. So the first one, nicotine replacement therapy. No big difference in the trials between them. Usually it's a combination of things. Usually we'll suggest a patch as a mainstay. And the beauty of this is, again, there's nothing negative about nicotine from a health standpoint. If your doctor and I could get you on nicotine for the rest of your life, we'd be tickled pink. The damage comes from the cigarettes, the other ingredients, not from the nicotine. So, again, that's an important factor that a lot of people don't realize. So we're avoiding the toxins. And if in the short term, we have to keep the nicotine, so be it. It is a first-line therapy as well. So again, we have the patch as the mainstay, and the short-acting, as you see in the video, there's a few different choices. There's inhalers, gum, lozenge, sprays. And that's usually how it goes as well. And we have access to some programs that we can maybe share with you a little bit later on. Oral medications that may help you quit smoking include the following. We have Champix, or in the States, it's called Chantix, a prescription product here in town in Ontario, and as well as Zyban. So both medications, and we're going to go over them in a little bit more detail to explain them a bit more for you. We also have a product called Cytazine, or Crave. This is a product that was developed in Ontario, and it's an over-the-counter or a non-prescription product. It happens to have a very similar mechanism as the Champix above, and it really kind of helps with the physical urges while you work on the behavior. And one of the other options is going to be a combination of the nicotine replacement with the Zyban above as well. Interestingly, I'll just mention here that all medications for smoking cessation are recommended for 3 months. And the reason for that is nothing to do with the medication. It's just that's how long it takes to learn a new behavior. I always introduce the idea of you have become an expert smoker. Congratulations. And what I mean by that is you've automated smoking. You've done it so many times that you don't have to think about it. For example, you may have a pack where you've got the cigarette out and lit and you don't even remember taking it out of the pack. This automated behavior is what we need to replace with a different automated behavior. And that's your non-smoking behavior. So what these medications do is they buy you time to work on the new behavior that you're trying to develop. And that's what I tell people when I talk to them is that you have now a part-time job. You need to actually work on developing your new behavior. Interestingly, people just think that quitting smoking is about not smoking. Unfortunately, with an automated behavior, it doesn't work that way. It's like saying tomorrow, can you forget how to drive a car? You cannot, because you've done that so many times, it's become automatic. You don't have to think too much about it. That's the same with smoking. It's an automated behavior. We need to replace it with a different behavior. Let's talk about the Champix or the varenicline. The benefits, again, it does avoid withdrawal symptoms, and it blocks the effects of nicotine in the brain. There's a little landing site in your brain for nicotine, and this medication blocks it. So what that does is when if you're taking this medication and you smoke, the nicotine or the medication in the cigarette itself doesn't do anything for you. It doesn't feel like you're doing anything. It doesn't give you any aha moment. It kind of feels gross and it tastes gross. And I'm sure you can, imagine smoking 20 times a day and not get anything from it, and maybe even getting an upset stomach every time you do it. That's not going to be very enjoyable. The beauty of this medication as well is because it's sitting on that receptor that I spoke about earlier, this medication stops you from going into any physical withdrawal. Very important point for many people. And that's why this product seems to have the highest success rate. It gives you that negative reinforcement of the bad taste and doesn't do much, but it also keeps you out of that physical withdrawal. So you can work on the behavior. Some precautions, you may see some mild stomach upset, and we do recommend that you have this one with a bit of food, and you will find that you will dream more vividly. So it'll feel almost real. So some people find that bothersome and some don't mind at all. So it's all depending on yourself whether that happens or not. And again, your pharmacist or your doctor who you deal with will help with that. So next one's a Zyban. It was brought on the market as an antidepressant many years ago, and we realized that it helped with quitting smoking from a habit chemical standpoint. So it reduces the cravings, or are you thinking about the cigarette as much? Interestingly, it can be combined with nicotine replacement, which is going to then help the withdrawal part. The Zyban works on the behavior or the habit chemicals. The nicotine replacement can work on the withdrawal. So if you have a strong physical addiction to nicotine, then you may need that combination. If it's more a behavior for you, then by all means, a Zyban may do it. Just a couple of precautions. If you have a history of seizure disorder, you may not be able to take this medication, and there are some drug interactions that may exist as well. So we just want to keep that in mind and talk to your pharmacist or your physician in that regard. As I mentioned, there's a product called cytosine or Crave on the market. Usually runs as a 5-week course, comes as a bottle with so many capsules in it, and it's about $50 at your retail pharmacy. Some do carry it, not all. And again, it is a 5-week course of medication, and you're going to be taking this to kind of help with those physical cravings, and it's going to keep you out of withdrawal. Nicotine replacement, as mentioned earlier, the mainstay is going to be a patch, which gives you 24 hours of nicotine, and you'll often supplement those for your individual cravings with gums, lozenge, sprays, and maybe even the inhaler. Gradual decrease of that nicotine over the next 10 to 12 weeks. And again, for some individuals, the patches may cause a rash on the arm, so we do recommend that you rotate those sites as best possible. Drug-smoke interactions. Interestingly, again, there's a couple of interactions that are significant when we look at trying to quit smoking. One of them is going to be caffeine. The caffeine in your coffee, for example, metabolizes, sorry, my apologies. The nicotine or the caffeine that you have is metabolized by nicotine. So what that means is you're only getting about half the caffeine that you're taking in right now. The body's metabolizing most of it through the nicotine that you take in through your cigarette. As soon as you start cutting down on the nicotine, maybe you're smoking less, then what's going to happen is that caffeine is going to hit you like a Mack truck. So you really want to be careful, and you want to cut that caffeine down as best you can. There are some other drug interactions, and as everybody's on their own medications, I do recommend that you check with your pharmacist on those as well. Interestingly, e-cigarettes or vapes, these are ones that people often will go to. From a nicotine standpoint, if it's just plain nicotine, by all means, it may be safer from the standpoint that you don't have other chemicals. Unfortunately, the vapes do carry nicotine in a base, and that base itself, there are some concerns with the safety of that base. So just keep that in mind. The e-cigarettes, interestingly, have not been shown to increase success rates among individuals who are trying to use e-cigarettes to quit. I think the reason is that you can use vapes almost everywhere. And that's unfortunately makes it more likely that you'll link nicotine addiction to some of the activities in your life. So keep that in mind, that it may not help you in long term with quitting. People ask about cannabis as well. The big thing with cannabis is if you do smoke it or inhale it in a form that is smoked, it will be more so, I think, a trigger for many people who smoke. It's often that combination that goes together. So if you do use cannabis, we do ask that you do use some of the non-combustible forms, oils, edibles, maybe a dry herb vaporizer, and that may help you in quitting of cigarettes, even if you choose not to quit the cannabis. So let's talk about the behavior or the psychology of quitting. There's really a couple of things going on here. There's going to be managing triggers, managing withdrawal, and really, again, we're trying to use distractions to kind of help develop that new behavior we're talking about. So let's talk about the triggers. You probably identified some in your mind as you were kind of going through some of the earlier processes of thinking about quitting. Maybe you've tried something different. Maybe you've mixed up your morning routine. Many people have cigarettes with their morning coffee or their morning routine, but also after meals. Some of the big ones are social situations, maybe when you're on the phone, maybe when you're at a friend's place, maybe breaks at work or social gatherings. Also, triggers can come in many locations, especially the car. Many people I speak to will, for example, get in the car and they'll have their seatbelt and the cigarette seem to, kind of go hand in hand. So smoking paraphernalia as well, again, ashtrays and lighters, you want to kind of keep those out of sight, out of mind so they don't trigger you. And again, maybe seeing others smoking or maybe being around other smokers when you're looking to quit may trigger you as well. So we ask you to kind of be cautious in that regard. We also have what's called the 4Ds or managing withdrawal. You can either delay a cigarette, that seems to help quite a bit. Drinking water, this is an interesting one with a water bottle. It's the actual water can help, but it's also that hand mouth addiction of doing that. Some deep breathing really helps you kind of focus and just kind of get past that urge. And again, the mainstay of the Ds are going to be the distraction. Remember, let's just kind of keep your mind off of it by doing something else. And the doing part is probably the most important. You'll see the actual little cartoon. He's giving up smoking, and you see the gentleman sucking his thumb. We definitely don't need you sucking your thumb, but if it was to keep a cigarette out of your mouth, that's not a bad idea. It's a lot safer, but we have lots of other things we can use for distractions. You can use snacks. You can use the water, as we mentioned earlier. Maybe cut up vegetables or fruit. Maybe I usually will include things like cleaning jobs around the house. Maybe if you have an instrument, you can play an instrument, or if you have other model building or hobbies, you can also do that. Going for a walk, playing with the dog. Those are really important things. Interestingly, when people quit smoking, their houses have never been cleaner, the pets have never been happier, and they spend more time with family members. So that's what they're doing. They're distracting themselves by doing these other activities. So a couple of health notes here. Let's just talk about as a pharmacist and healthcare provider, I want to also let you know there are screening tools that I think you should probably look at. This one's called the Canadian Lung Health Test. And you can see the actual questions there. Do I cough regularly? Do I cough up phlegm regularly? Do simple chores make me short of breath? Do I, for example, do you wheeze when you're actually sleeping at night? And do you seem to have colds that last longer than your friends? So if you've answered yes to any of these and you have what we call a 10 pack year history, so a pack a day for 10 years or half a pack a day for 20 years, if you're having yes to any of these, I do recommend that you contact your physician for a spirometry test. We're really trying to screen for COPD, which is a lifelong chronic condition that is related to smoking. 99.9% of COPD in North America is actually from individuals who smoke. So we just want to identify these early just to kind of give you a hand. Some other screening, obviously, we want to do if you do have a greater than 30 pack year history of smoking. That's going to be if you just take the number of packs you smoke times it by the number of years you've smoked. So if you're about a pack a day, 30 pack years, if you're a current smoker or you've quit within the last 15 years and your age is 55 to 80, you may benefit from lung cancer screening as well, because individuals in this category may have an increased risk. We just want to make sure you catch it early if it is there. So, all right, let's talk about next steps for you. First of all, you have homework to do. You have to identify your triggers. And I want you to really think about those triggers and say, okay, what could I do for 5 or 10 minutes when these triggers come up? And I want you to make a physical list of these distractions. And sometimes it's helpful just to think of them as developing a new behavior plan. So this list of activities that will help you develop them will be non-smoking activities so that you become an expert non-smoker. And also, I want you to practice mindfulness when smoking. Really be aware of what's going on. Just kind of, step aside from yourself and really just notice, okay, I feel that I'm getting an urge and it's related to maybe a meal time. It's related to something around me. And really notice that. And that's what we call mindfulness, just becoming mindful or notice things around you as they're linked to your behaviors for smoking. And why not set a quit date? Setting a date really does add some accountability, and it does get you one step closer. And so we also have availability of counselors within the community itself for one-on-one counseling. And again, working with a clinician and having them help and working with them does increase your chances of quitting by about 30%. So you may ask, what kind of resources do we have available for us? And why don't I show you here? It's a really good one here. This is actually, the first one we have is that big blue sign. It says Smokers Helpline. So you can go smokershelpline.ca, or the phone numbers on the screen there as well. This is a really, really good resource. They can actually help set you up for motivating texts. They have a lot of resources you can download with respect to dealing with stress. There are other types of programs as well. If you look at the list, you may have an EAP program that maybe helps with quitting or smoking. We do have addiction services of Thames Valley and the Canadian Mental Health Association in our local area around here in London. The public health unit can help you as well, but probably the biggest one that we find people accessing is the Smokers Helpline. It's available online, easy to access with your phone as well. Telehealth Ontario does have a telehealth number. And again, it's marked on the screen as well if you want to copy that down. There are special programs for certain subpopulations, especially the queer and transgender groups. We have an expandproject.ca for yourselves if you want to access that. Feel free. Some great apps as well. We have Break It Off. It's a Canadian Cancer Society. That's a really good one. My Change Plan, or I Can Quit. You just go into your app store for whatever format of phone you use, and there's going to be lots of apps for helping to quit smoking. Most of them should be free as well, so there's plenty of free ones out there. You don't need to worry about that. So have a look at those. Accessing free NRT. We actually have free nicotine replacement. We have a program in Ontario called the Stop Program. So www.joinstopprogram.ca. And you can self-enroll. And again, you can be linked in with an actual provider who can help provide you with up to 26 weeks of free nicotine replacement products. The self-enrollment is online. Then you need to connect with an actual site. And I'm going to have some more resources on where those sites are. And they're going to be here. These are the sites within the Thames Valley Family Health Team. And again, to access the STOP program or free nicotine replacement is available to everybody in Ontario. So again, accessing one of these sites, these are the names of the medical clinics and the phone numbers for these clinics themselves. So you can always just say, hey, you know what, I joined the STOP program and I need to connect with your nurse or your pharmacist who run your smoking program. I just want to get some help getting some nicotine replacement. So in the London and region, St. Thomas, in the county as well, Strathroy, Ilderton, Mount Bridges, as well as Woodstock and London proper. So have a look at those clinics and see which one might be near you, and you can then contact that phone number. And if you just want to contact a phone number, if you're having trouble finding a site near you, they can assist you as well. Yeah, so Stop on the Net is another option as well. The same Stop program, but a little bit different. So they will actually ship you a certain amount of nicotine replacement as well. So that's called www.stoponthenet.ca. And those are probably going to be your best options. You can always go through your drug plan as well through work. Again, talking to your physician or your community pharmacist can help you access those as well. I'm not going to say too much about this program. We have a lot of resources linked to the STOP program. This is just another ad for them as well. For your prescription medications, let's say you've decided you're working on the behavior, but you need a little bit of help and you want something to help with maybe the cravings. So if it's not nicotine you're after, maybe it's the oral medications or the cytosine. So your family doctor is an option. But interestingly, the community pharmacists have been able to prescribe Champix and Zyban for smoking cessation for about 10 years. So go see your community pharmacist, ask them for medication to help you quit, and they'll be more than willing to assist you with that. If you find that you don't have a pharmacist nearby and you want to talk to your doctor about it as well, your doctor or nurse practitioner can give you prescriptions for those two products as well. peer support. Well, guess what? As mentioned earlier, we do have these sessions in a live format as well. It's still virtual, but again, it's going to be real time. So feel free to sign up or register for one of our groups, and you'll be able to talk to others who may actually be, kind of working through the same things that you're working at trying to quit smoking. And again, the session evaluation, we're not going to go there because this is an archive session. So that works. And at this point, I'm going to say good luck with your quitting. Hopefully, we can be a resource to you if you need us. And if not, just go see your community pharmacist as well, and they can definitely help you. Take care and good luck.